If you've had children, just saying the word labor can bring back all kinds of memories, right? But is there a way that you can laugh your way through the pain? Janice Cusino, nurse director at Hartford Hospital, is here to talk about laughing gas potentially being used for moms who are laboring and expecting the birth of their baby. Good morning to you.
Good morning. It's very nice to be here. Thank you.
So before we get into that, talk about, for people that don't know or people that might not remember what was used for them, if anything, what is the normal use of pain control during that?
Well, right now, a lot of women will use narcotics to get them through their labor, or they use an epidural, which is very common.
So what would this do? This is essentially nitrous oxide, right?
Yes.
Okay.
So this is, we just started using this a couple of weeks ago. We're very excited. It's a mix between 50% nitrous oxide and 50% oxygen.
Okay.
And it's used to, it's another option for pain management. Prior to this, we had limited, interventions. A lot of women didn't want to use narcotics because, that could potentially affect the baby. An epidural was commonly used, but now we have this new modality, so we're very excited about it.
Now, I think I used this when I had my wisdom teeth out. Is that the same concept here?
Similar, but not exactly the same. The nitrous oxide that we use, our concentration is used for pain management. It's an analgesic, whereas in the dentist office, it's used as an anesthetic. So our concentration is different, and it's self-administered by the patient. And I actually brought our mask that the patients will use while they're using the nitrous oxide. The patient has to be able to hold the mask herself, and she puts it over her nose and mouth, tight seal. She takes in deep breaths, and she feels the effects of the nitrous oxide during her contractions.
And so what would the effects be, essentially? Because it's not going to remove the pain entirely, right? Does it just make it more tolerable?
It does. It minimizes it takes the edge off, and it also helps reduce anxiety, because many times during the labor, it's the anxiety that can be problematic more so than the pains, but it does help with the pain management and the anxiety.
So is this something that most people could use? Are there some candidates that this would not be a good idea?
There are a few. If the patient had received narcotic already, she could not use the nitrous oxide. Some patients that if they have a vitamin B12 deficiency, they cannot use nitrous, or if they have sleep apnea. But those are rare occasions. So the majority of women, they will be evaluated by their obstetrical provider, and they should be candidates. They should be able to use this.
All right. Well, wish it was around when I was giving birth. Goodness, I think I had morphine, which made me feel very nauseous.
Exactly, right.
Yeah.
So the effects are in and out very quickly. So within 30 seconds of inhalation, you start to feel the effect, and within a minute after you stop inhaling, the effect goes away. So it's very self-controlled by the patient. And if you do deliver at Hartford Hospital and see one of our obstetricians, we do have brochures in the doctor's offices that explains the whole program. And so far, we've had rave reviews from our patients that have used it.
Great. Well, anything to lessen that pain.
Absolutely.
Because we all know what that's like. All right, Janice, thanks so much for coming in.
Thank you so much.